is growing. I want to introduce to you today Luis Hernandez, who is one of our fabulous clinical educators here at New York. He is so learned and so his expertise in meso as well as medical aesthetic is amazing. So hi, Luis, welcome aboard, Nuvior.
Good morning, Lina. Sorry. Good afternoon, Pina, and everyone. Thank you for having me.
Excellent. So Luis and I are going to conduct our webinar today. So I want to join everybody that's here today. Welcome everyone. And definitely this is an exciting day because we are launching a new product here in Canada from Mesoaesthetic. So please remember, if you have any questions for myself and Luis, we ask you to share your question in the chat box. So please ask questions here. And of course, we will answer you. As always, with every one of our weekly webinars, we do have a special promotion for that product or treatment for this day. So at the end of our webinar, we will post the code to get you additional savings on our featured treatment today. So without further ado, I'm going to share my screen. Not that one. With further ado, I will share my screen. There we go. So welcome to the future of medical innovation. We are Nuvior, and we are a very fast-growing company that distributes amazing technologies and innovations from around the world. But not only do we offer amazing treatments and devices, we support you with marketing, education, and continuing education as well. So we want to help you grow your business. And here at Nuvior, we do bring the world's best to Canada. First, our exciting launch that should be happening by the end of 2024 is our Aptos thread lifting methods, a complete, minimally invasive and safe face lifting procedure with ultra thin threads that will hold in the face for up to 2 years. And we're so proud to say they are a 6-time winner of the Aesthetic Medicine World Congress Awards for suspended threads. We have brought in one of the best devices for PRP available on the market. Eye tissue PRP from Fedia gives you reliable, concentrated results that give you everything in one inclusive disposable system. It too has been recognized at the Aesthetic Medicine Awards by the World Congress, and it also has won Best in Regenerative Care for 2024. And of course, our lines. We do have 2 fabulous lines, our medical grade lines, mesoaesthetic and dermaceutic. We will be speaking about mesoaesthetic today. And dermaceutic is a great line to support all your medical aesthetic treatments. So whether you're just doing chemical peels and microdermal needling, or you're doing devices with lights and lasers, this is a beautiful brand. And it works so synergistically with mesoaesthetic that they're great to support even the meso treatments. And of course, at Nuvior, we want to be your one-stop shop. So we do want to ensure to you that we have all of the medical supplies you require for your establishment. And if you do want something and don't see it on our website, just reach out to one of our new viewer team members and we will try to source out that product and guarantee price matching. And without any further ado, let us get busy. I'm Kina Lee, your clinical education lead. I love to support, I love to share my knowledge, and I love to share my department with Luis Hernandez. He is a chemical engineer as well as a nurse, and with his years of the medical industry experience, he is here to continue to offer you support with Nuvure. Today, we are speaking about a fabulous new treatment that has been brought to you by Mesoaesthetic. Now, this is the only one available in Canada. It is called melanostop tranex, and it is a depigmentation peel for all skins. Now, we know Meso has been around since 1985, and over the years, they have given us many, many SKUs for peels, up to 21 various peels. Unfortunately, in the Canadian market, we were not had access to these peels. We do have access now to the Meso peel. And they have done some major reformulating and rebranding because Mesoaesthetic has such a strong brand that is recognized by clients all over the world. They wanted to ensure they stay there by offering specific solutions for medical as well as aesthetic industry. So now they've taken those 21 different products that were very challenging to segment. There was a lot of overlapping, a lot of interacting. So they have reformulated it. So if in the past you were familiar with some of those peels, you'll notice that now they have made it simple. And it is a new look. It is a new era for the Meso peel professional. So as I said, they have segmented these products into an aesthetic portfolio, which will be in your white boxes, as well as the medical portfolio. And like always, in the darker color, like our Derma Milan from Mesoaesthetic. These products have been completely reformulated and oriented to indication for treatment rather than just the ingredient. So now you have a specific concern, you pick the indication by the name of that concern to the product. And of course, they wanted to make sure that what they are giving you is got greater efficacy and is going to give you those immediate, tangible results that are always supported with clinical evidence. And of course, they are from the leading specialists and experts of depigmentation for you, the expert professional. And when it comes to our meso peel professional, you do need to understand they're a chemical peel. So they're going to work as an exfoliating treatment. And chemical peels, when you speak of dermal cosmetic procedures, are there to create a controlled injury in the skin to accelerate cellular regeneration through those exfoliants. So it's not like a dermabrasion where we're roughing up the skin. It's not a physical exfoliant. We are using chemical or chemo exfoliating agents and peeling to cause exfoliation in that upper epidermis. And by reducing the top part of the epidermis, we're stimulating and rejuvenating deep into that skin and creating new collagen as well. So this kind of treatment has many different reasonings to use. We use our chemical peels to get rid of extra skin, improving the texture of the skin, purifying that skin. And when you're talking about purifying the skin, you're speaking about those, the sebaceous glands and the hair follicles. We can also combat the signs of aging with chemical peels by softening fine lines, smoothing out wrinkles, and creating that unified texture and color and tone of that skin. So we're going to help with pigmentation, whether it's solar, whether it's caused post-inflammatory hyperpigmentation, or even our freckles and superficial melasma. These are all things that we can target with peels. And if you categorize it, you've got acne, aging, and pigmentation. So yes, mesoaesthetic does provide solutions for all of these, but here in Canada, we do have limitations. So what are the main characteristics of our mesopeel, professional peels? They now are segmented by indication. You will get tangible and immediate results with the new reformulated mesopeel professional treatments. The packaging has been improved and now it is at that pharmaceutical quality. Because let's face it, Mesoaesthetic is a pharmaceutical company that delivers medical solutions for professionals around the world. So they apply that same science, mentality, and manufacturing process to even their professional products for that esthetician. And of course, you're going to get precise and synergistic combinations of these agents to give you optimal results, quick and easy results, safe for all skins. And as always, made and backed in science with guaranteed clinical studies. So now we have an exclusive transversal peptide that's common across the board. And of course, we've got the studies to show it. So when it comes to the new packaging, if you're familiar with the old one, they are larger. They now are a 50 ml, and they are designed with that medical cap with the sealing. It's designed to keep it sealed better. The labeling is also designed to be in high quality mark, and it is a larger volume of the product. So with that enhanced security, you've got that special cap that locks it in and it seals it. So it's going to continue to preserve that product. That's got the increase in the glass of the thickness of the glass, and it's got the amber color to keep it more stable with its formulation. Now, when you're talking about the new ones, and then I'm going to pass it on to Louise, you can see in the mesopeel professional range, it is segmented by your indication. So here in Canada, we are very proud to say we have the melanostop tranex. And now, without further ado, I'll pass it on to Louise. Louise, please.
Hello, everyone. With this new melanostop tranex, it is a depigmenting peeling with a complex formula that accelerates epidermal renewal. It's going to help removing melanin built up on the surface of the skin, and it also provides visible improvement in tone and luminosity. It is safe for all skin types, for all phototypes, from Fitzpatrick's 1 to 6. With this new reformulation, we have an innovating, regenerating, transversal active ingredient called xenopeptide. The name xenopeptide comes with the word senescence, which is cellular aging and stopping of the cell proliferation. This will lead to the cells accumulating and secreting inflammatory molecules that degrade tissues. With our new transversal peptide, the xenopeptide, it's going to provide anti-aging action by selectively eliminating the senescent cells or the cells that have been slowed down, and it will optimize cellular metabolism. This xenopeptide is mesoaesthetics' own molecular design. As we all know, mesoaesthetics is all about science, and just like with other treatments such as Dermamelan and Cosmelan, they have patented and created their own molecules. So science is such a big part of mesoaesthetics, and that's why we have such an amazing result. We have a study, an ex vivo study, as we can see on picture A. The lamin B, it is a protein. It is a protein that during senescence, it's going to reduce the fibroblasts. Therefore, by using xenopeptide for only 1 week and increasing this lamin B1 protein, we can see the fibroblasts increasing and getting thicker layer. We have another ex vivo study using our xenopeptide for only 1 week on a 71-year-old skin. We can see a rejuvenating effect that can be observed both at the senescence level in picture A1 to B1 in the control. We can see that lamin B1 was increased, and therefore the fibroblasts were also, the layer of the fibroblasts was increased, A1, B1. And in our A2, B2, we can see the level in the extracellular matrix, procollagen 1. As we can see, the cellular metabolism has been increased after using xenopeptides for only 1 week.
It's amazing how fast these ingredients can get to that living tissue, isn't it, Luis? That it doesn't just make that temporary change of exfoliation, but actually changing the dermis of the skin within 8 days. It's just amazing.
And the results are cumulative. So the more treatments we do, the better the results.
Mm-hmm.
On top of this transversal peptide, the xenopeptide, we have other ingredients such as glycolic acid, salicylic acid, we have tranexamic acid, hexylresorcinol acid, kojic acid, and caffeic acid. With tranexamic acid, it will inhibit the inflammatory and vascular component of hyperpigmentation by reducing tyrosinase. Tranexamic acid would act in the keratinocytes by preventing the secretion of substances that speed up melanogenesis. It will also improve inflammation and excessive vascularization of injuries such as melasma and post-inflammatory hyperpigmentation, which are those blemishes that we get from cuts or acne. The pH will also make it an active ingredient with high tolerance for our patients, so it doesn't produce that irritation that other pills will do. At the same time, we have hexylresorcinol, which again, it will act in the pigmentic action and inhibiting tyrosinase. As we all know, tyrosinase is an enzyme that helps promote or with the fabrication of melanin, which is what gives us that hyperpigmentation. So it's going to inhibit tyrosinase. We have also kojic acid that it will block tyrosinase by copper chelation. It will reduce melanin accumulation, and it will unify the skin tone and texture.
And kojic acid is also a beautiful antimicrobial. So if you do have someone post-acne who wants to treat their pigmentation, Kojic also helps, like salicylic, to kill that bacteria.
Another depigmenting active ingredient in our melanostop tranex, it is caffeic acid, which is a high antioxidant ingredient. It will intervene in the melanogenesis and it will enhance the synthesis of structural elements in the cells.
Mm-hmm.
What are the indications for this melanostop tranex? It will treat superficial and epidermal hyperpigmentation. It will help with mild solar lentigos, with ephthalites, as known as freckles. It will help improve dull or uneven skin tone and photoaging.
Mm-hmm.
Here we can see some before and after 5 sessions of our melanostop tranex, and you can see the reduction of hyperpigmentation.
And the luminosity of the skin is incredible. The texture looks firmer. Everything looks beautiful. And here, go on, Louisa.
Again, using UV imaging, we can see as well the improvement on this photoaging. Here is another one where we can see the skin with more luminosity, help with the lentigos.
Sorry. Yeah.
No. Next. Now, what is the protocol for this treatment? Is super easy. First step, with like any other treatment, we're going to cleanse the skin using the Hydra Milk. We will use either a tissue or a gauze or a facial sponge. Then after that, we will degrease the skin with our pre-procedure cleansing solution. To increase the intensity of exfoliation, we can always rub the skin with a dry gauze before we apply the peel.
So roughing it up before you put in the pre-peel. Exactly.
After doing that, we're going to protect those delicate areas such as the commissure of the mouth, here in the nose. People that have deep nasolabial folds, we can always put it there, and around the eyes. So we need to protect those delicate areas before we do the treatment. Now, the peel application. The number of recommended layers, it will be 2 layers, and we will do each layer 5 minutes apart. We will leave one layer for 5 minutes, and then we will apply the second layer, always paying attention for frosting. If you see too much frosting on your skin, on your client, please do not apply the second layer, just leave it there.
Or too much redness, yeah.
Too much redness as well, yes. After the exposure time, we will wash the area with just a damp gauze. But if the client still feels some discomfort and tingling, we will use the post-peel neutralizing spray. We will spray it and we will allow it to act for a few minutes. After that, we have 2 options. If we want to enhance the treatment, we can apply our post-peel 1 retinol concentrate. After doing that, we will just jump onto the SPF application. If we don't use that post-peel, then we will use a mask, one of our regenerative and repairing masks, such as the crystal fiber mask, the anti-stress mask, or the fast skin repair.
Yeah, so I would do one of those masks and then finish with that fast skin repair, because that is going to help to, you know, keep that barrier healthy again, reconstitute the protection that we've just ripped off with our peel. Go ahead.
And then we will finish with our amazing Melan sunscreen SPF 50+.
Excellent.
Recommended sessions for this treatment, we can do 5 sessions in the intervals of 15 days. And after these 5 sessions, we can maintain the results doing a peel every 2 months.
Beautiful. And of course, with any product treatment that we offer here with Mesoaesthetic, we have the support products to continue your treatment results at home. Because you do always have to remember that 20% of your desired results will come from the professional treatments in your clinic. But to enhance those results, keep them going, the client needs to use products at home. And for this, we do go with the Melantrans 3 concentrate and gel cream. You can see each of them have a little variation in their composition, and this is to help you use them independently or together. At home, we have that concentrate and the gel cream. You will use them both in the evening. And I need to stress, and I'm sure Louise can adhere with me here, that that concentrate is concentrated. So 4 drops, not a full dropper, just 4 drops of the concentrate is all you need on a nightly basis. And then you can layer the gel cream over it or blend them together. And then during the day, you would use the gel cream only. And I always love to pair that up with your vitamin C's and other antioxidants. So with that beautiful tranexamic acid, it's going to continue to work like a shield at that melanocyte, at the dendrites, keeping that melanin from carrying up. Also with that tranexamic acid, it is going to be a beautiful solution for those with that vascular focus pigmentation, the redness from acne, or the redness with your melasma. This is beautiful for treating skin before major medical cosmetic procedures such as lasers. This is also a great way to prep the skin in lieu of something like hydroquinone. So again, there's other products that do support this. We've got the beautiful masks. The mask I would recommend to support this would be a Hydra Vital mask. And then, of course, our gorgeous ampules, such as the melatonin with the glutathione in it, is beautiful for that skin. And our proteoglycogen ampules is another gorgeous example of treating and nutrition for that skin. So to recap, we do have our gorgeous new product for the Canadian market. I know we don't have the others, but you never know in the future. So for now, you can deal with depigmentation. And of course, we always have our Cosmelan and Dermamelan that are going to be more for that deep, stubborn pigmentation. This is a great way to prep the skin for your Cosmelan and your Dermamelan treatments, getting that epidermis ready, starting that lightening process, getting those melanocytes in step with what we have in store for them. So to conclude for today, pardon?
Pina, there is a lot of clients that don't want that heavy peeling. They do not have the downtime or the lifestyle that doesn't allow them to do Cosmelan or their Dermamelan. And this is a perfect way to start their treatment and to prep the skin in the future when they can take either Cosmelan or their Dermamelan.
Excellent point, Luis. And to reiterate, this is a beautiful way to prep that skin for your Cosmelan and Dermalan. It's an affordable treatment. It can be used on the face and the body. It is safe for all those photo skin types. It is a layer dependent peel. So you can do a light layer for that more sensitive skin, or you can be more aggressive, as Louise said. Use a gauze to rough off the skin before actually starting your treatment. So you will get effective, immediate, tangible results from the depigment experts at Mesoaesthetic, and of course, all the support here from Nuvior. So we'd like to thank you for joining us. Luis, you did a fantastic job today. And I'm excited for more webinars from Luis and our team. Price per session. So you do get the entire jar is it's under $200 for the jar with any peels. And when you're talking a peel from Meso I would definitely start at least 175 and up. Luis, would you agree?
I think that's a good price point for this.
Price range. And then again, you can always upgrade it with your post peel 1%. That can be an enhancement or an upgrade. If you are going to end it just with a simple mask, I would do the anti-stress. And then again, you can upgrade it and have another charge for when you add the sensitive crystal fiber mask. So there's different ways of building the price of your treatment as well. And for all that have joined us today, as a token of appreciation, as promised in the beginning, that's your code. So simply use this code when you're offering. Now, I'm not sure about the amount of supplies we have. So if you do want to stock up, I would. They're good until 2027. So you have a few years to use them up. And this code here for the promo will be valid for the entire week until our next webinar next week. So we will also like to tell you that if you are a clinic partner, whether you own or work for a Nuvior clinic, please ensure that you set up your own personal account. I know Luis and I always sit around saying, what are you buying next week? What are you getting next time? Because we get 20% off, just like you. So take advantage of the generosity of Nuvior. Get your personal products from us. You will save 20% off of clinic pricing for your retail products and personal use. And then, of course, if you do know anyone that is interested in joining, as Luis did, we are hiring. We are continuing to hire across Canada. So if you or anyone you know is looking for an opportunity with an exciting company that is growing by leaps and bounds, please let us know. I'm Pina Lee. You can reach me by phone, text, or WhatsApp at my number. And I want to thank Luis Hernandez again for joining us today. It was fabulous. And I do want to open up the chat to anyone that has any questions. Any more questions about this product or anything else that we offer here at Nuvior? No? Luis, did you want to add anything else in before we say goodbye?
No, thank you everyone for joining us. And if you have any other questions, even after the Zoom meeting, please let us know. And we're happy to help you in any way we can.
Excellent. So if there's no questions, I want to thank everyone and we'll see you again next Monday for our next installment of our weekly webinar. So have a great day, everyone. And please let us know if you need any more support. Oh, thanks, guys. Bye. Bye, Louise.
Bye.